So as we promised, you asked us some questions, and now we'd like to ask you some questions. Who would like to start?
Cheryl had a good one. Do you remember it?
We had this conversation. I had two. One is, I was curious about the comment that I think you made earlier. I'm sorry, I forgot your name. Around measurement, who measures, who do we measure for? Because I think that's really at the heart of it. I mean, I think that word, and I think you made reference to it, we use this word like we all know what we're talking about, we all know who does it, and we all know who we do it for. But I'd just like to put it back to you in terms of when you asked that question, what were you thinking and how could we get into a better discussion? Oh, were you? Sorry.
All right, yeah, I was thinking that because I'm an engineer and every day I found myself measuring stuff for myself and never share with anyone. And at the end, I share something totally different that they can understand, you know, or they expect to hear, you know. So I found myself doing things that they don't see, they don't know, for the measurements that I get for myself. And then, you know, I share with them something totally different that they can understand, yeah. So I was wondering for the, for the designers if this is the case as well.
Yeah.
Is there one answer to that question? So I feel like when you do evaluation training, they tell you that the first thing that you need to do is establish who the evaluation is for and what the purpose of the evaluation is, and it's often going to be different. And so I feel like my view is that there probably isn't a single answer to that question. It's not for any one person. It's going to have different functions in different projects at different times, and it's the important thing is building into the process of thinking about it that very question of who's it for, what are we trying to do. Well, that's my feeling about it.
I have a related question, but it requires, I think I could not agree with you more, but one of the things I think we can really accomplish with this conversation is being able to articulate with confidence what it is we do. We were just talking to Jill about it before we started, and it's true. It's true. I mean, it's true for me. It's true for everyone I know, because you find yourself in these conversations where you've got financial people or you've got people who want an answer, and it's you're viewed as the soft skilled person or whatever it is. And so as I think about what we want to do, which is create a resource, right, I would love to know what would help you all be able to articulate the value of this, because a big part of this is selfish, right? It's being able to frame a dialogue about what it is. It's being able to understand it so that we can get better. But it's also so that we can stand in a room and articulate what it is we're trying to do and how to think about the benefits. And so as we think about this online resource, I would love to know some of the things that you think would benefit you.
Since I'm holding the mic,
That's
I'm just
my
going to say
question.
something, but then I'll pass it on. I don't know the answer to that, but I just wonder whether one aspect of it is separating the value of the process and increasing people's understanding of the value of the design process, and simultaneously but separately raising the profile of what you can achieve through that process. And I feel like maybe an analogy is agile methodology is now something that's quite accepted, and I guess that when it started, people were like, what, you don't have a plan, you don't know how it's going to work. So and I guess it was the proof was in the pudding. But I
was just going to kind of, I suppose that relates to a comment that you made earlier about kind of the certainty of the design, well, the design process isn't certain, and that's the kind of thing. So we've got a joke in our company that other designers from other design fields can walk in and just be like, it must be lace, or it must be blue, and everyone kind of, yeah, well, obviously you're a fashion designer, we completely agree with it. And they don't have to explain the kind of the theory of change or the process or anything. Whereas with our clients, we often do have to kind of painstakingly explain how we came up with the idea, as if there's a kind of a scientific methodology for doing that. And I don't know, I suppose, what's my point? I suppose that's my point. But it's a kind of, it's a balance between being able to, I think to your question, like what do we need, is we need to be able to, as well as show impact, is also show a bit of the theory of, or be able to speak back to them in their language of the theory of change, of how you get to something. Yeah, a colleague of ours has been helping us do that, which has been very helpful. But yeah.
Maybe just a comment on that. I think reminds me of one of the projects that I was involved in at MindLab with the Danish Ministry of Social Affairs, researching or trying to help or improve social services around sort of vulnerable families, especially vulnerable young people. And if there's a system in the Danish public service system that is filled with accountabilities and measurement, that's the one. Because there's been so many bad stories over the years, so you put more and more, accountability structure into it. And obviously at some point that's going to be too much, and the social worker will think this is meaningless. Like I'm trying to allocate 90% of my time doing something that's not about the people. So obviously there was a recognition in that project that we needed to do something different, and we tried to experiment with, the obvious thing is you come back with those stories where both the front line and the citizens are both saying, well, the system doesn't make sense, it makes us worse off, and I want to quit my job, or whatever stories you might have. And we take those stories into the room or the workshop, and we even try to bring the civil servants out in the field and experience those things. But it doesn't really make a strategic difference. And a part of the thing that sort of made me think about this was perhaps our lack of confidence in terms of actually owning our insights in a particular way, in a confident way. And I think what we tried to do by then was to turn our insight into sort of a narrative frame that was more strategic. Because actually what the frontline personnel were saying is that we have lost the why in our jobs. We cannot see why we're doing this anymore. We experience it in the concrete meetings, but in terms of how the system's operating. So what we tried to do with the Ministry of Social Affairs was to try to create basically design principles of the system that was not counteracting what they were doing or their intent, but it was trying to bring in the why, the strategic narrative of why are we doing this. And I feel like more and more projects are going in that direction, and some organizations are beginning to get better at becoming not just user researchers or whatever they get diminished to, but actually strategic sort of framers of an agenda. And it's actually one of the things that I think agencies outside of government, or while there are a lot of labs already being built in government at the moment, they don't hold that mandate. So they actually need someone from the outside helping them coming with that sort of more strategic framing. So I think that, to your point about storytelling, I think that, it can be quite powerful. And I think the question of what's credible in that sense, I think sometimes that story is more credible than the other thing.
I was just going to add about my experience with the hospital and about some of the things that you were saying, that perhaps we need to speak more in the language of which the organisation that you're working within can relate to. And why one of the things that happened to me is we did all this looking at all the different users and who are the people that are experiencing. It was when you come into the emergency department of the hospital, So all the different people, all the levels of communication, who needs to know what. We did all this, and essentially I needed to go back to them and ask them, is this right?
Mm-hmm.
Have we interpreted Have we interpreted everything that you've said? Is this right? They only had to say yes or no, but they sat on that for 12 months because they didn't know what to do and they didn't know like what it meant afterwards, and it was difficult for them. And so eventually I, after many times trying to get them, because this is I initiated this project and they got the funding for it, and I went back and I said, look, either I'm going to just forget about this, or I'm proposing that I come and we just sort of do some workshops. We bring in whoever we can get in. It's really cheap, fast. We do within a day, within a week, we'll have something, just kind of like that. And they just said, you're speaking the way that we operate. And I said to them, it's an experiment. I have absolutely no idea what the outcome will be because we don't know what it is we're going to do and if it will work. And they just went, that smiles on their faces were just like, God, it's just how we work in the emergency department because everything we do is that. And then it changed and everything kind of changed from there. So going from a language that we was kind of talking made no sense until I spoke in the way that they operate. So that was just
So you're talking about a difference in the language of the way of working, not necessarily where one person speaks through a spreadsheet and another person speaks through successful participants. Yeah. And we've already got that dynamic that's complicated already, or someone else is thinking about investment of time. So there's something about bringing together those different unarticulated ways of doing things that I think if you're a good designer, you can slow down and unpack with them. But that's, I
think because for them, and obviously every organisation is quite different, but when you're talking about people whose job is to save lives every single day, the last thing that they want to think about is add something on. They run around like, headless chickens, just, it's constant. Everything is reactive. They work in an environment that they don't have time to think about strategic investment to make the thing work better because they're too busy in the now. So once I kind of started talking that way, it made sense.
Brilliant.
It's a historical thing as well, isn't it? I don't know if it was the 1940s where there was a Journal of Improvisation in Health. Yeah, I think it was in the US actually, where basically the whole concept of this journey was nurses sharing the stories of improvising on the job to get the job done. So at that time, that was actually a legitimate story to tell, and that was measuring to some extent, good practice. Whereas now, that it's a totally different paradigm, and those stories are illegitimate.
That's the thing with the measuring part. I'm not sure because there was, kind of comments as we were sort of doing things really analog, sticking them up on the thing with coloured paper and stuff like that to see if things would work. And people would come and saying, oh my God, this is going to make such a difference. I open the door for 30 people a day and they're doctors and things like that. And the experience of people coming in, how do you measure when you don't, if it's their only time they come into an emergency department? I don't know how you measure any of that if the outcome of what we've done has made a difference, only for the fact that staff might go, they feel better about it. They're not asking for measurements because they think it's going to work. So
you might ask them.
I have, yes, I have said, because it literally only went up this week, finally, to tell me if people are asked less about what's happening.
Well, it gets to some of the things that Anne LaFond was talking about with this maternal and infant health grant, right? Does it change are these people more likely to do it? You know, are more of them likely to be happy with what came out of it because they had a voice in it? You know, but they're all things that you can determine in advance that you want to know. Sometimes it happens by surprise and you have to go back and think about what you wanted in advance, but we all do that too.
I've got another question for you, most excellent panel. One of the assumptions that comes up is that you're always starting a project from scratch. So it's a pristine project where nothing before has got any influence on what happens, and nothing afterwards will ever be the same. And you can design this perfect, social design experiment. And actually the reality is different. Often you are inheriting a process or an organisation that already exists. And so one of the questions that came up in New York was, hang on, what happens when it's something that's just a continuation or maybe a tweak of something? And I wonder if any of you have got any thoughts about something that you've changed that already exists, and what measures or what thinking about measures you've put in place. As in, Cassie, you've just been talking about influence and not about... No, just because your organisation's already been going for some time, I wondered if it was... how did you start to think about what you're thinking about?
We've actually not been going for very long time. Really, since January this year.
Right.
Because last year was a very different shape of organisation. So we've got pretty much a new team.
So the organisation's changed, the team's changed, and therefore the measures can change?
Yeah, I think how we're thinking about what our purpose is, what our theory of change is,
Right.
what the point of us is very new. So we're really at the start of thinking about. I've never worked. Well, actually, I've never had a job, so this is my first proper job. But I've not really ever worked in what is really a think tank or an influencing organisation, rather than actually designing services. So we're not going to be doing delivery.
Mm-hmm. So influence is the perfect thing for you to be looking at.
Yeah.
Yeah.
So, yeah. So it doesn't relate to your question at all, sorry.
Okay, no worries, no worries. I just put the question there for...
Yeah, if anyone's got any thoughts about how we measure influence, and I think that it does also relate to more of the systems change stuff. So the systems changes programme, again, that was about how can the insights from frontline workers influence change over time. And I think when there's many actors in a change process, it's going to be more about influence than impact. I mean, the impact will just come a lot later. So I'm just generally interested in anyone that's got any thoughts on influence.
It reminds me. So I used to work in the Home Office in government and in the policing directorate, and I just remember the point you made about measuring over time, things changing, but also I remember there just being a big conversation and lots of submissions going up to ministers about changing a question in a long-standing survey, which is the British Crime Survey. So it's been going since 1970 something or other, and they realised they needed to change the question, but they were like, oh, but to make it a better question. But they were like, but if we change the question, then how are we going to know the impact since 1970? And we literally for 6 months went around writing all these submissions and various things, and people getting themselves into a big tangle about it. And it just made me think about I don't particularly have an answer, but it just, when you were talking about how, I suppose it's the impact of something changing when you observe it, or why are we thinking in numbers, but maybe it's just a general, oh yeah, things have changed and it's much better, which is not a kind of a chunky answer at all, which a return investment angel investor would want, but more of that kind of just standing back and, I don't know, it's kind of more of a visual systems it just looks and feels a bit different, which is not the robust thing, but...
I think there's a bunch of intuition in this, yeah?
And it's going back to your point about trusting or asking people, well, does it feel better for you? That is a kind of an impact measure. And if we need to do out of 1 to 10, so we can put some numbers around it. Maybe we do.
There is that, I'll just say quickly, I'm just quickly looking at the name on my Instagram. There is this new book that I've not read yet, because it doesn't come out until the 1st of June, but it's called Hunch, and it's, you know, turn your it's basically about, it says intuition is more valuable than ever, and I feel like that's also something that gets totally missed out of a lot of the language around this, when actually it's so powerful.
It's a great guide. Yeah.
The other thing is a lot of things in the social sector or social impact is around qualities and observable qualities and felt qualities, and you just know it. I mean, if you decide that you want to work on the quality of generosity because that's what you want to work on, and you and I are friends, and I say to you, well, how can I help you? I would say, I will just observe you for a month. And because qualities have to be observable. They don't get measured, they're observed. So if you say today you want to be more generous because that's a quality I want to work on, and we're hanging out, I can say, wow, I can see what you're doing, and I can actually tell you the behaviors you're doing that actually start to have you be more towards that quality. So I think that, you know, particularly with culture change, I mean, I think we can measure it, but we can also observe it, and it can be felt. And we shouldn't minimize that, because if we're trying to change the qualities of something, it's going to be felt and it's going to be observed.
But I have to say that that's also a kind of measurement.
Yeah,
It also,
that is.
it comes up a lot with students. I was just talking to a student, must have been yesterday morning. He's going into a second year. He's really committed to doing something about racism. But right now it's just that word, and he doesn't know where to start or how to start. And we had a conversation about, you know, what is it that you can observe so that you can record that or take stock of that, so that you know where you're going to intervene and if you're making a difference. And so even though these things are, you know, they're not countable, and as you say, I absolutely agree, they're observable, but there still needs to be a discipline brought to it. Right. Because I also think, you know, designers, we're all guilty of, or we're all accused, not all guilty, of letting, of the woo-woo part of, you know, this emotion, you know, wanting to make people happy.
There's a really lovely data project which probably lots of people have seen, but it's called Dear Data, and it's in lots and lots of data visualization exhibitions because it's an analog data visualization. But anyway, it's these two women, Georgina and forget the other girl's name, woman and Stephanie, and they are writing postcards to each other between New York and Italy, and they each week observe a different behavior or emotion or something kind of soft about them. So it might be like, all the times I've been really annoyed with my boyfriend this week, or whatever else it is, and then they will do a kind of an analog data visualization on a postcard and then send it, and they've got this beautiful collection of postcards. But I suppose it's just the point that observations can be quantified in that way. And
yes, and another point too, and I think I know that work. Then we have to say, how, if you want this to be about a social problem, it has to be about more than two people, right? And because everyone interprets those things differently, then how do you apply any of those standards, you know, across any community?
Yeah, that's a very valid thing. So last year I was in India and I was working on this project around gender equality, which was really fascinating. It was new for me as well because I am from India, but I've never seen it studied or worked on something like gender equality within India. So I was working in a lot of rural areas as well as suburban areas. But the interesting thing was that I was working with companies that were based in UK, in Europe, and I could see that the different lenses that everybody was trying to view those certain systemic problems from. It was very, very strange because I think at that point my role sort of suddenly became somebody who was cultural translator in a very rough way, because everybody from the UK and European companies had a certain paradigm of thought around what needed to be measured, what needed to be corrected, why, and therefore that was a lens from which they were going into India to actually either create new propositions or interventions around that. Whereas when we actually started talking and working with the people who were in India itself, you started realizing that if and this was just sort of theory at that point, if those interventions did take place, they would create a certain social imbalance. Because I think this is something very relevant to social design as well. Every design intervention that we make has a certain beginning and an end, right? And we of course want to measure it as well. But whether this is related to systems thinking or I don't know. But there are these other forces at play as well, which it's all related to intention, basically. It's related to intention of design, but also intention of measurement. So when we go into a project and we want to design something or you want to measure something, the thing that is really, really weirdly relevant is who is the person, what's the context in which we are measuring something, and what is the intention behind it. Now I feel that that's one of the things which often doesn't really get talked about.
No, we should add that.
I've just got a small point on that question about whether it's possible to get people to measure what's important to them in a way that enables you to take a one person or one person by person view. There's a methodology called most significant change methodology, which is a way of asking people, as a result of what we did, what was the most significant change for you?
Could you say the name again?
Most significant change. And I think one of the reasons that's been interesting is that it's enabled people to collect in a quantitative way the kinds of changes that people have self-defined as being important. So I think this question of who defines what should be measured and what's important is really important, and you can't lose track of that. But there are some interesting ways when people start really grappling with that. There are ways of sort of making it neither subjective nor imposed.
And a whole new discipline and rigor that comes from that. So Maggie Breslin, who's doing this patient revolution, this whole project is about giving patients the wherewithal to make better decisions for them. And a big question for her is who decides what the standards are, right? It's not for the medical profession to say what that is, but then flipping that and really measuring, it's a whole lot more difficult than taking, a small professional group.
Absolutely.
And then just one tiny thing, in terms of measuring influence, something called outcome mapping frameworks is quite a useful approach, because you're looking at who you're trying to push along the journey to where. So we've had a project like that we've found that was probably the best approach.
I think we're all going to come and visit you.
It's really fascinating. I think just on that note, and on your note about qualities, which I think is probably at the core of this in a way. Measuring influence. We haven't talked about politics yet, which sort of, I would say, makes me think about a discussion I had a few years ago around the objective of design. And my former director, I had some clashes with him around that. His narrative around design was about targeted solutions, around you can do this stuff and we will get it almost right, and if not, we have a process for making it right. And I try to remind him to say, well, we are actually working within a government context or in a political context. So what about, where does politics fit in? And might our work be more about qualifying the political debate in terms of actually exploring, different views of different viewpoints or different political agendas, and seeing what's the implication of this, so we actually have a more valid standpoint to be having a more qualified debate. And I actually think you can measure that, the quality of debate, or at least the quality of the different viewpoints. So I just wondered if you sort of explored that. And then there was a question you get to answer. And the other thing I was thinking of when you were talking was like, reminded of the several times, and this is a question for all the independent consultancies in the room as well. How, in your view, how good are governments or others that you work with to do their own baseline? Because one of the advantages of this work is that we can view the world in its complexities, which means we also view the problems from the user perspective, which also means that we can begin to really visualize how entangled the risk system is in this outcome for this family is created by 8 different agencies that has no idea about what this costs for them. So basically it's impossible to do a baseline, which really makes it impossible to do measurement in the way that they want it anyway, in terms of figures and numbers. So I'm wondering, I'm curious of whether you could sort of play that back and say, well, okay, if we can't make the measurement, then what can we do? And then that opens up a segue to invite another paradigm of measurement in, where it's more about learning and exploration. In very few cases, we've successfully sort of said, well, okay, if we don't have the baseline, maybe we should be doing this first. And then somebody mentioned sort of co-creating or co-defining the measurement criteria as we go along. Because I find that the governments I've been working with, they have no idea how much their things cost. The Swindon example is another one of those where they exploited that.
Absolutely.
Yeah.
They're a step ahead of them.
I don't know if there was a question more than a comment, actually. What do you do at FutureGov?
Around baselining. So we baseline our products because we started working with Nest 18 months ago and we got when we started working with Nest 18 months ago, we got investment from you and you introduced us to your framework, which is staged, and taught us about baselining. So we run surveys, but they're not statistically rigorous. So one particular example is a product we run called Casserole Club, which connects people that like to cook with isolated elderly people. And we do surveys with elderly people to understand kind of before they use the service, during, because nobody really quits it, so which is quite nice, how people's views have changed. But as I was talking about the cost and expense of measuring, for a small organisation, we do a survey probably with about, each round, about 30 elderly people, so it's not, it doesn't have much statistical rigour around it, but we're honest about that when we talk with clients, so it's not, we're just the limitations of what we're able to do as being a small company. So that's one example that we do use baselining because it's quite a specific intervention, whereas some of our slightly more amorphous consultancy projects where we don't really know the real problem we're solving till halfway through, it's quite rare. I talked earlier about our engagements tend to be sort of 6 months or so. It's quite rare that we move into the space of delivering an intervention to a cohort of users directly. Sometimes we do, sometimes we test prototypes and that kind of thing, but it's quite rare that we certainly don't deliver anything scaled, although we try and scale up our organisations to be able to scale the work that we've started doing with them. We don't really tend to baseline around that, which is why I was talking to Jasper just when we had the breakout about how you might baseline and measure capability transfer, skills transfer within organisations, because I've tried to start doing that, but I don't really have much to base that on.
I've got something for you.
Yeah, great.
Afterwards.
Yeah. So yeah, short answer, well, long answer really, but we try with our products where it's really defined. We're less good when it comes to the longer term.
So just to wrap things, I've got one more question, but the point is that you answer it downstairs in the bar. And the question is, given what we've talked about today and all the things you've heard, some might be new, some might not be so new, what do you want to do next with this? And sorry?
You have to remember until you get downstairs.
You've got to get downstairs, but if you want to say one quickly.
Well, I was thinking that I'd love to meet up again as a group because, yeah, because
it's good stuff, isn't it?
Yeah, it's really interesting, and I don't think there is a group that talks about this, so it'd be really useful.
All right.
All of your examples is great. I've just written down loads of stuff. So I'm going to go home and research, share with my team, or everything. You've got all tools, please.
Brilliant.
Thank you. So I can steal them and make my own versions of them. That'd be really helpful. Thanks.
So I'll do another meet and get in touch with you. But I just want to say thank you so much for coming. It's a beautiful night. You could have been doing other things, but I'm really glad you're here. And thank you to the fantastic Cheryl and Jesper for bringing some substance and bringing the conversation we started in New York here.
You were all really engaging and terrific, so thank you.
Thank you.
Brilliant. So take some fruit.
Brilliant.
Thanks very much.